Hey everyone, welcome back. I am so excited for this conversation today. It's a really important conversation as part of our extended reality and AI in healthcare series for My Care Friends, which is sponsored by Magic Horizons. I've met some wonderful people on my journey, and Linda Ciavarelli is one of those. She is doing some incredible things out there. She's a pioneer at the intersection of storytelling, patient experience, and immersive tech. She is the founder and CEO of HouseCall VR, which we're going to get into a little bit throughout. It's a company that's been exploring how extended reality can help patients better understand their health. But beyond the company, Linda's work reflects a growing movement to make patient education more visual, engaging, and human-centered. And there's never been a more important time than that now, and especially related to caregivers who help those patients. So Linda, it's great to have you here. And before we really dive in, can you tell us a bit about your background and what led you to the world of XR and healthcare education?
So first of all, thank you so much for having me on the podcast. I really appreciate the kind words. It's been, we've known each other for a couple of years and been in sort of similar circles. And so it's really an honor to be asked to be on the podcast and share a little bit about our thoughts on this particular intersection of XR and healthcare. So thank you very much.
You're welcome.
A little bit about me. I'm a podiatrist. I've been in practice for 20 years and interestingly practice until recently. Actually, I just recently stepped away from private practice to focus full time on HouseCall, the startup I think we'll talk about. But luckily in my practice, I was able to meet and serve an incredible variety of my community, including very, very, very high net worth individuals and all the way to one of the poorest zip codes in the country. So my practice actually physically straddled that landscape. And so had the opportunity to meet an incredible variety of people. But one thing that I saw over and over and over is as our understanding of health and disease becomes more complex, it's challenging to understand what's going on. And so I often was meeting patients as a podiatrist, primarily patients with diabetes, but other chronic diseases as well, who really didn't understand even the basic tenets of their disease. And I think everybody was very focused on teaching patients what to do, take this medicine, do this thing, eat this food, whatever. But nobody kind of stopped to say why. And so, with all the challenges today, it was really, really difficult. And so people were really grateful when I took time to explain to them just this simple, this is what diabetes is. And, I can't tell you how many times, Todd, I heard, I've had diabetes for 20 years. Nobody's ever explained it to me. And so that was sort of the lens that I came from. And when I was first introduced to immersive technology, one of my kids got a MetaQuest headset for Christmas many years ago. And I honestly put it on and thought, well, why aren't we using this thing to show patients what I'm trying to tell them? And that's what led me to where I am today.
Thanks for sharing that. I love the stories of how startup founders found what they found. It's just, there's always an incredible why to it, and you just shared the why. And it's tremendous what you are doing and being a caregiver, patient advocate. I've dealt with similar situations where you'll have a physician who will give you a pamphlet or send you on your way, and you'll ask as many questions as you can in the 15 minutes that you have in the office, but you don't really get the grasp. And certainly HouseCall VR is a big help in that, for sure. So in the problem overall, what are some of the biggest gaps that you've seen in how patients are typically educated about their conditions or care?
Oh my gosh, how long is this podcast? I mean, let me try to boil it down. The statistics are really grim. Uh, Somewhere around 89 to 90% of the US population has limited or low health literacy. And so that means the ability to understand, interpret, and act on your health information. I would argue to say it's 100% because at some point, even myself as a physician, we all have moments like maybe there's an emergency, maybe there's a devastating diagnosis for oneself or family member. Your health literacy goes to zero. All you hear is the word, or all you are worried about is breathing, or whether it's yourself or someone that you care about. And so, we all have these moments when because of the situation, we just cannot understand, interpret, and act what's going on. So that's the most extreme case. Now, if you think about it day to day, as providers, we're being squeezed. We have less and less time for patients. The average primary care visit is 15 minutes. That's an old statistic. I would probably say that it's less than now, with an average of 6 topics covered. So, and as we're living longer with more complicated, chronic diseases, all of a sudden having an in-depth conversation about any of those, let alone all 6 within the time frame, is really not realistic. So that's one problem, is the time pressures of providers today. Another is the variability. You may have a really incredibly smart provider. Maybe they're not such a great communicator, or maybe they don't, sort of metaphorically speak your language or actually speak your language, right? So that's kind of 2. And then third is the standardization. There is no standardization in patient education, save diabetes. I will say that's one of the places where there's a standard for patient education. And thankfully, because it's a largely self-managed chronic disease. Although, again, as we're moving into managed chronic diseases, as opposed to just, succumbing to disease, these challenges grow and grow. So those are the biggest. The last is, that it's primarily spoken word. And the way that I speak, the way that I talk, the way that I explain may really resonate with you, but maybe it doesn't resonate with the next person. And so, and people forget, remember a very small fraction of what it is their provider tells them. And what they remember, about half of what they remember, is wrong. So, clearly there's a problem. And right now, to your point, the answers have been brochures and, Dr. Internet, now Dr. AI.
Yeah, I know everybody wants to go to Dr. Google, or now Dr. ChatGPT.
Yeah.
And but it's true. And like we were talking about before we started recording, you have that situation where, to your point, patients are getting all this information in such a short amount of time. You have all these communication challenges, and the patient is often overwhelmed, especially when it's a serious diagnosis or having to do with a serious diagnosis. There's only so much they can take in. They're trying to regulate their emotions. They're probably trying to regulate their breathing in that short period of time. It's coming in, and we all know everybody can get into a fog. You can get into the fog. You're almost like a deer in headlights. And so this is where the caregiver comes in. And of course, because of my care friends, I always like to bring it back to the caregiver. You have a caregiver that hopefully there, whether it's a family member or a hired caregiver, whatever it might be. The caregiver really is important in this, and it's important within this XR intersection. And so the question for you is, in your experience, how does XR actually change the way patients and caregivers understand health?
So the example that I love to use is not about health. It's an icon that I think we all know. It's the Statue of Liberty. Have you ever been to Liberty Island? Have you ever been there?
Yes.
I'm going to wager, unless you grew up in New York City, that you probably saw an image of the statue or maybe a video before you actually were there, right? So you could definitely recognize this icon. when you're there, and you're on Liberty Island, and you're looking up at this incredible thing, this icon, but also like this physical structure, or you're on the boat around her, and you see, your relationship with the statue is very different after you have that three-dimensional experiential understanding in a physical sense, right? When you go back and you look at a video or an image, your experience is different than a two-dimensional image. And so that's kind of always the example that I give. You could use the Grand Canyon or, any other sort of, whatever. It's when you are immersed in something, it is fundamentally a different experience to understand and learn than you are in a two-dimensional way. And I think we all, during the pandemic, we all sort of recognize that, right? Oh, we'll just have Zoom meetings and that will just change everything. But it turns out that actually being in a three-dimensional space with someone really has meaning and value and extends understanding in a way that a two-dimensional medium just can't. And the research is there, and there's been decades of research looking at VR as a medium for a variety of things, but specifically looking at patient education. Omer Liren at Cedars-Sinai, he did some work in 2017 looking at educating patients about HIV medication therapy, and so it was a short 7-minute immersive experience where people were able to understand, what happens when they take their medicine, to experience it, right? Be inside of their body, and what happens when they don't. And saw a significant increase in their CD4 cells, which means that they were likely being more compliant with their medication, and a decrease in their viral load, again, showing that they were likely more compliant with their medication. This has also been shown in other studies or studies around hypertension education, seeing that patients really understood things better afterwards. They were also, interestingly, much more satisfied with their providers, which is a metric that in the healthcare industry is very important for a variety of reasons, but one of them being reimbursement mechanisms. They can really hinge on whether or not your patients are, satisfied. We've all gotten those, surveys afterwards that's there. And then lastly, there's work around surgical conversion. And that's actually really interesting. So imagine this was looking at neurosurgery, a group, I believe it was in 2022. I'd have to look for the exact date. They were looking at a neurosurgery consultation in a 3D environment, and they saw a significant increase in surgical conversions, which means physicians say you need this procedure. And a lot of people were really hesitant. I don't know if I want to do it. I don't know. And so they really saw an increase in the amount of people who felt more confident and felt better about moving forward. So those are just some examples about using immersive technology specifically in the patient education space and how it can be utilized, in a really successful way.
Well, that's great. That actually took my next question. So that's perfect. You went into the examples. So give me an example from a HouseCall VR perspective, where it's made a clear difference.
Yeah. So, and just quickly, HouseCall VR, we make patient education content using immersive technology. I kind of say we're like Magic School Bus meets WebMD. It's a little way to do that. We make short form content where people can understand their health and their medications through immersive technology and offload that repetitive conversation from the provider, making it standardized and available in multiple languages. So one of the ways that we see, and I've seen in my clinical practice, and then also throughout our testing and collaborations, is people have that aha moment that I never understood it this way. That, like, I just keep hearing that over and over, and I'm looking at a quote that I keep up on my board. This explained it better than anything I've seen, and I've had diabetes for 20 years, right? And I've heard that myself from many, many patients. So the ability for someone to transcend, health literacy, right? Like maybe I use complicated terms that you don't know, or even reading fluency, right? That's an issue, or language barriers, or maybe I'm a visual or experiential learner. The ability to sort of transcend all of that and then have an experiential understanding of something that can be very complicated, but to make it very simple, that really resonates with people. And I've had patients come back and say, oh, Dr. Ciavarelli, I was thinking about that experience where I was inside my body and the glucose was building up because I didn't take my medicine. It like sticks to your hands and stuff, and the experience, it's not very nice. You have rising tension. And so I was thinking about that, and man, I was going to go eat that donut. And I was like, I don't want that to happen. So, that's great. Like that's behavior modification through experiential learning.
Amazing. I mean, you're preaching to the choir here, but it's amazing. I love this. Let's turn to XR across patient populations. What kinds of patients or scenarios seem to benefit the most from XR-based education? Are there certain populations?
So I actually really love this question because I think a lot of people think about XR as a pediatric focus, like young adult focused medium. I will be honest with you, my experience has been completely the opposite. Now, of course, I am a podiatrist. The vast majority of my patients are, 60, 70, 80, 90, 100, like this, that's the population that's where I live. So interestingly, the quote that I just shared with you, so we co-developed content around medication adherence with the University of Georgia, the College of Pharmacy, and we did a small testing of two different populations, really small, like 7, 8 people. One day we were testing some diabetes medication content on or I guess not really testing, but just evaluating diabetes medication content on healthcare students. And the next day was 65 and up. And the interesting thing is that every single one of the 65 and up thought that this was incredibly engaging. The 65 and up crew, the students, they thought it was cool, it's great, this is really useful, I could use this in teaching and teaching my patients and whatever. The 65 and up crowd, ooh, oh my gosh, I can't wait. Like the novelty, the interest, the experience was just so incredibly profound for the older population. And when I say older, Todd, the oldest person that we've tested this on was 88 years old. So we're not talking about, sort of midlife, like these are septuagenarian, octogenarians, really older populations. So I would advocate that although younger people as digital natives probably have more access to this, I think the profoundness is really there for older populations.
Something came to mind, and I just have to say it because, like you, we're originally, or you're still in the Philadelphia area. I'm originally from the Philadelphia area. Experiential, this goes to what you were talking about earlier and also ties into now. And the first thing that came to mind was as a kid walking through the heart at the Franklin Institute.
Yeah.
And how that changed, because at first you're reading it in a book in science class, like, okay, whatever. But when you are experiencing that, that's, talk about immersive. I mean, what an incredible experience. So VR brings that to so many more people. So how does an XR company like yourself, how do you design content that resonates across different age groups, now that we're talking about the differences, or health literacy levels, which you alluded to? How's that done?
Well, we're very lucky, along with our co-development with the University of Georgia College of Pharmacy, we were also able to collaborate with the VA through a program called the Greenhouse Initiative. And I highly recommend any company, whether you are a new company developing new technology or an established company developing something new or a new product, if it touches healthcare, my advice is go check out the Greenhouse Initiative. It is a product refinement pathway, and we were lucky enough to be able to be a part of this, where we were able over the course of almost a year to collaborate with 6 different locations, and you know, really like from early discovery all the way through, you know, hey, what do you think? Is this great? Like actually going to these places. It's important for me to note that collaborating with the VA does not mean that they are endorsing us in any way. It's always very important that I say that. We were able to, through this collaboration, to obtain over 700 data points, almost 50 hours of testing, over 100 testers, all the way across from veterans to clinicians to clinical staff to housekeeping staff. I mean, you name it, anybody was welcome. They're very, very, you know, man off the street kind of almost. That was really, really important. So I would say, you know, that's the long answer. The short answer is user-centered design. Find the people that you are designing for and ask them. Don't presume that you know. Interesting also, one little caveat. I talked about this at AWE when Ann Bailey and I were talking about user-centered design. One of the things kept hearing in our experiences were it's too slow. It's too slow. The voiceover is too slow. The pace is too slow. It's too slow. It's too slow. So we kept hearing it and we're like, oh, okay, I guess we got to speed it up. But we actually looked at who was saying it was too slow. Who was saying it was too slow was the clinicians because they already knew it. Not one patient said it's too slow. So I definitely ask, but pay attention to who's saying what and understand who it is exactly that you're designing for.
That's a great answer. And I'll have to take the opportunity, since Magic Horizons is the sponsor of this program, that we love working with the VA as well. We work with many VAMCs, CBOCs, CLCs across the country. It's just, they're wonderful to collaborate with. They don't endorse. We understand that. That's important distinction, but they're very supportive of companies and new technologies and bringing it out there.
In particular, XR.
Yes, particularly. Absolutely. And you and I have talked offline about this, not just now, but when we've seen each other at conferences. We love working with them. They're just, the people are great in their innovation groups, and everybody that we've come across at the different VA facilities, I'm looking over here because I have my map. They're heart-centered. They come at it and they have a very incredible why that they do it, as you and I both have as well. So how can XR help not just the patients, and we alluded to this a little bit more, but talk about more about how it helps supporting their families and the caregivers and the clinicians as well.
Yeah, so I'll start with the clinicians because I think that's kind of, you know, that was when we were designing HouseCall and not just the content, but also the platform as a clinician, that was really critical. You know, like where can we make this as frictionless as possible? And in particular in XR today, in VR in particular, you know, we are asking people to put a computer on their face. That is a barrier, and there should be no other barrier. So we went about designing a solution that was, you know, doesn't use Wi-Fi, takes 30 seconds to onboard, that's, you know, useful for anyone. There's hardly, you know, and so how can we make it just as easy, 2 clicks in, just easy, frictionless. So that's one of the things that we did is we were developing in particular to offload that repetitive conversation that the providers are often having, okay, I need you to do this thing, but first I need to explain to you why. And so really like taking some of the burden off the provider and allowing them to focus on, okay, now you understand, let's do this. So we see that as the support for the provider, and also through reimbursement pathways. As far as the clinician, the caregivers and family members, having an experience that is isolated is, can be incredibly profound. But when it's inclusive of their family members, so for example, in our solution now, you can go back and watch a video that's accessible. So people can go home and they can show their grandkids, hey guys, I was in VR, this is what I did. Or, this is what I learned, to a family member that's there, that is also, is able to see what the person is learning. Now, not the same as being in the VR headset, and that's something that, as immersive technology becomes more ubiquitous, I think will be easier to disseminate. That's one of the challenges, is that it's, very siloed and fractionated, and not everybody has a Pico 4E headset, like that's just not the kind of thing that everybody has yet. But I think that, as we're moving into more immersive interface forward technology for everything, don't take my word for it, take Meta's word for it, and ByteDance and Pico's word for it. I mean, these are, huge companies that are making that bet.
Yeah, absolutely. No, they're all great points. Let's move on to what I'll say: barriers, challenges, and ethical considerations as an XR company. Um, Maybe we can speak to this in general terms. If you're an XR company, what are the biggest challenges? Not necessarily HouseCall VR, but overall, what are the biggest challenges to adopting XR for patient education, especially to do that at scale?
Well, I mean, I think I touched on that earlier, Todd, that, there is a barrier to a new interface. And that, in VR in particular, as we talk about XR, of course, augmented reality is something that people are talking about, this week, mixed reality, these things are really coming. But when we're talking about VR, where we're like really fully immersed, we have a VR headset on, that can be challenging. And so designing something that has as little friction as possible. So, sit down, headset on, 30 seconds. That's my goal. When we started, was less than a minute, and now it's less than 30 seconds from the moment my medical assistant walks in the room till the patient's fully immersed. And that's for everyone. And if it's not, it's considered a failure. So, and that has to be true, because of what we talked about earlier in the conversation about the time pressures. My staff would murder me if I slowed things down, and like they need, like we all need this thing to run and run well. So developing that's a huge barrier. I think other barriers are simple things like Wi-Fi.
Not
Wi-Fi
so
in
simple.
hospitals
Not
is
so simple.
bad.
Right.
Yeah, exactly. It's bad. It's
Yeah.
it's bad everywhere. Go to the fanciest hospital you can think of.
Yeah.
Bad Wi-Fi, because it's complicated. There's a lot of stuff going on. So, why not develop something that works completely offline? Why not develop something that literally just needs a power source? And so that's a consideration. Obviously, data and data privacy. That's a huge thing that needs to be considered. In our case, we do not collect any private health information. We are outside of all of that by design, because sometimes, that can, of course, be very useful, but also just to get something working also is really helpful to keep it as, to avoid that. So, and then lastly, around ethical considerations, I think primarily around access, creating something that people that have more means only can access, I think is not something that is scalable. I think designing something that is accessible and specifically designed for people that may not have means, So for example, again, for us, a very, approachable price point for federally qualified health clinics, all the way to multiple languages, to cultural relevance, to all of that. That's really important. We don't want to design something that only a small fraction of the population can access. We actually really want to design things that everyone can access, in particular the people who need it the most.
Yeah, that's a great point. I'm going to go off the grid for a second and ask you a question. In your experience, how does this all play into medical coding and reimbursement? Because that's a big topic for anybody in XR. So, what do you know about that area?
Well, I know a lot about podiatry billing, and I will not bore you with any of that because it's complicated. So around XR billing, we're a little bit outside of that, being patient education. Patient education, from a reimbursable standpoint, is primarily reimbursed like very specifically around diabetes in a very specific construct. But now there are new pathways for reimbursement through larger sort of what I would say is value-based care. And so, when you think about, now I'm going to try to keep this as brief as possible. So when you think about, you go see your doctor, they talk to you, they give you advice, or they kind of do something, give you a shot, or whatever, and that's the way they're reimbursed for their time. There are mechanisms coming online that are looking at, okay, what about you, doctor? Like, how can you actually be reimbursed for not just giving Todd a shot, but actually making Todd better, right? Or avoiding a hospitalization. And so that's where there are these pathways, these care management pathways that are coming online. And happy to talk to anyone about that if they're interested in it. That's from a patient education perspective. Interestingly, on the direct reimbursement, so for interventions, pain management and other these interventions that are coming online, these things are happening, and there are organizations that are looking at this, that are in conversations with the FDA. I'm sure Todd, a lot more about that than I do, because we're not, we as patient education, it's a little bit of a different thing than an intervention. But all of this it's really coming online, and because the value is so clear, and the technology is really coming to a hospital near you.
Absolutely. So let's look at the future of XR within health education specifically. What does the next 5, 10 years look like?
Well, I think, looking at the greater landscape of technology, I think there are two sort of giant sea change moments that are upon us. Obviously, AI is a huge thing, personalized care, personalized content. I'll even say content, right? Even if you think about it from, from a commerce perspective to a health perspective, personalized and individualized digital communication is definitely upon us. And how can we use that? That's a big question for us, and I'm sure at every other technology company. How can we leverage put together the immersive technology piece and this incredible power to personalize an experience for someone, and put that together and make something that's that's even more impactful. So that's one. And then the second is the next generation of our of the internet. Really, we as humans, we started looking at we started telling stories is how we first started communicating, and then we started writing things on walls and drawing pictures, and then creating written language, and then images and movies and all of that, and all of that's still two-dimensional, right? I think right now we're at a moment where a three-dimensional interface is happening, and I think in the next 5 to 10 years it will change from our two-dimensional interface, a phone, a screen, a flat screen. We'll still have that, but there will be an interface that is three-dimensional, immersive to some to some extent, but in a completely different way than it is now.
It's got me thinking. I'm thinking forward. I'm also thinking that we're going to talk offline because I have an idea about potential collaboration with My Care Friends and something that we're doing at the university. So put that aside for the audience. Gosh, this time has flown by, and I so appreciate you being here. I mean, it's helped people understand more about XR, not just the technology side, but the human side of it. And as you talked about, access to it, giving patients and caregivers, just more confidence and clarity to talk about it. And I'm sure you join me in saying to the audience, talk to your physicians, learn about things, bring it up to your physicians. And so in parting, we hope you follow this series, and share it with your loved ones, other caregivers, exploring immersive education. And for HouseCall VR, I encourage everybody to check it out online. Certainly you can contact Linda. She didn't say I could do that, but I'm sure she's okay with that. Contact her and learn more about it, because they're doing some great work. She talked a lot about diabetes, but I know they're working on other healthcare modules that are important to learn about. And so, Linda, thank you so much. It's been such a pleasure. I know we always enjoy having conversations offline when we're at conferences and so forth, but doing this for the greater public is just been a blessing.
Thank you so much. I really appreciate, it's an honor to be on the podcast. And, I hope that someone's gotten some value out of this. And yes, please do contact me. I'm on LinkedIn. It's probably the best way to find me.
Cool. Thank you so much.